This literature mapping review is part of the initial phase of a larger project supported by a GO8 grant from the National Library of Medicine of the National Institutes of Health, focused on promoting health literacy among migrant and seasonal farm workers in the United States. As we began to explore existing literature to identify patient education resources for migrant and seasonal farm workers, we decided to perform this mapping review to assist others in locating the health-related literature relevant to the special population. Our goal was to identify existing literature and research specifically addressing health issues of migrant and seasonal farm workers in the United States. In developing our search strategy, we initially pulled terms and concepts from a variety of migrant health-related resources and quick searches of several databases, then brainstormed to identify other search terms. We then presented these terms to our advisory board, which is made up of researchers and professionals directly engaged in supporting farm workers to get their suggestions. Once we began search strategy development, we removed or adjusted terms that broadened the search too widely or didn't pull the concepts we were actually interested in retrieving. With our advisory board's approval, we chose to utilize the Health Resources and Services Administration, or HRSA, definition of migratory and seasonal farm workers, which is available on their website at hrsa.gov to determine inclusion criteria used to define our population. The HRSA definition of migratory and seasonal farm workers includes the requirements that work be agriculturally based and workers migratory or at least seasonal, not employed in a stationary job. We also use the HRSA definition to determine exclusion criteria for our population. There's a large body of literature focused on farmers and farm workers who are neither migrants nor seasonal workers, and even among literature identified by combining the terms migrant and farm worker, the populations of focus did not necessarily meet the HRSA definition and were excluded. Examples of more difficult exclusions included seafood workers who may be migratory but were excluded because the product with which they work is not produced on the land. Most literature addressing health issues among migrant dairy workers was also excluded as the workers were year-round employees. We additionally limited to works addressing workers in the United States. We chose to search databases based on where we anticipated locating literature on health issues. PubMed is the primary database for health-related literature from the United States, so this was used to develop our initial search strategy. We anticipated finding pesticides exposure issues addressed in toxicology abstracts, mental health issues included in PsycInfo articles, agriculturally focused work in Agricola, and Spanish language publications in Lilacs. We additionally screened the first 100 Google search results for inclusion. No filters or date limits were used in the database searches. When we pulled the final numbers from our database searches together and deduplicated, we were left with fewer than 8,000 items. Screening at title and abstract level allowed us to exclude all but 1,040 items, which were then carried over to the coding stage. We were surprised by the limited quantity of literature even potentially focused on our population of interest. During the screening process, we retained all items with potential to meet our inclusion criteria. We then moved forward with the coding process using codes iteratively developed based on the Commission on Social Determinants of Health conceptual framework from the World Health Organization and the interests and research concerns of study team members, grant partners, and advisory panel members. Prior to initiation of actual coding by the students on our team, protocol reliability was established at Krippendorff's alpha of greater than 0.70 on each item using side-by-side coding by two primary researchers and students. Coding descriptive classifications include, but are not limited to, where studies were conducted, population terminology used in the study, and if health education materials were used. Topical classifications include, but are not limited to, alcohol, drug use, mental and behavioral health, living conditions, sanitation, water, and housing issues, pesticides, diabetes, dental care, and nutrition, all issues that challenge the health of this population. Our coding activities were delayed due to COVID-19, and we are currently cleaning the data, but preliminary findings reveal that a good portion of the identified papers focus on the Eastern migrant stream. 60 papers likely contain educational materials, and multiple topics are represented in this literature. Feel free to reach out to us and we will be happy to share finalized results as they come in.